This is Michelle Sullivan at the summer meeting of the American Academy of Dermatology, where I'm talking with Dr. Lawrence Eichenfield, who says atopic dermatitis and food allergies can travel hand in hand, but skin testing isn't always the best way to disentangle the relationship.
Well, we know that atopic dermatitis is incredibly common. 10 to 15% of children will have it. And what's pretty clear is that if you look at children with atopic dermatitis, they'll have more of a tendency to have true food allergy. So it's a group at risk for having food allergies. Unfortunately, we have a few problems. One is that parents would like to think that eczema is caused by a secret allergen and that if you identify it, the eczema will go away. Unfortunately, it's not that simple. And another problem in taking care of individuals in clinical practice is that allergy testing, whether it be skin prick testing or specific IgE blood testing for allergies, has problems with it and that they're really overly sensitive. So what that means is you can test a child for a few allergens, the test may come back positive, yet those children may not have clinical food allergy. You can give them the food and they may have no reproducible symptoms from that. So the NIH, actually the NIAID, now has food allergy guidelines. They were published in December of 2010, January 2011, which discusses atopic dermatitis in relationship to food allergy. It recommends consideration of allergy testing for children who have persistent eczema that's not responding to good topical regimens of care, and those individuals who may have a history of food allergy. So that's one of the takeaways. Identify that food allergies can be prevalent in some of these individuals, but don't go searching for the secret allergen that might fix the atopic dermatitis, and we still have our principles of good eczema skincare.
Well, is there any reason to take these children one step further to actually having a food challenge, an oral challenge test?
Unfortunately, the answer is yes. That many times if you have a set of food allergy tests and they're positive, it's just a starting point because you don't know if the positive test means that they necessarily have a clinical reaction. But if they've had a food reaction to other foods in the past, you might have a life-threatening reaction to giving them food. So if they say, there's a question, they've avoided the food, but they may have an allergy, you may need to do an open food challenge, and usually that's done by an allergist, often in a setting where emergency care like epinephrine is available. It needs to be done to really figure out if they have the allergy or not.
So for parents, when do you advise them to actually have some emergency treatment available at home, like an epinephrine pen?
Yeah, so any child who's had a significant reaction to food, significant reaction is going to be a reaction such as swelling of the face, or even an immediate food reaction such as vomiting consistently with giving of a specific food. They've had a real significant reaction, then that child should be prescribed an EpiPen, and the parent should have an EpiPen or an EpiPen Junior at home. Hopefully they'll never need it, but you don't know if the next exposure could be a life-threatening reaction, in which case having intramuscular epinephrine around can be truly life-saving.
Well, thanks very much. I appreciate your time.
Thank you so much.